Imagine this, you start a new medication to manage your weight and suddenly your sex life feels different. I'm talking about dryness, irritation, and even a brand new term floating around the internet, Ozempic Vulva or Ozempic Vagina. What's really going on here and why are so many people whispering about it? I'm gonna let you know. Hi everyone, welcome back to the channel, or if you are new here, welcome. I'm Dr. Holly, sex and relationship therapist, and today we're diving into one of the hottest and most confusing topics in sexual health right now, Ozempic and vaginal health. If you've seen the headlines or scrolled through TikTok lately, you've probably come across the term Ozempic Vulva or Ozempic Vagina. But is it real? What does the research say? And most importantly, can you actually do something about it? Stick around because I'm going to dive into all of that right now. Let's start with what Ozempic actually is. Ozempic is the brand name for a semaglutide or GLP-1 receptor agonist. Originally, it was developed to help people with type 2 diabetes regulate blood sugar, but it also helps with weight loss big time. That's why it's gone viral over the last couple of years. People are seeing dramatic transformations and it's basically become a household name. But along with the weight loss, people are also noticing some changes in their sexual health and specifically their vaginal and vulval health. Cue the new buzzword, Ozempic Vulva. So what does that actually mean? According to reports, people taking Ozempic and similar GLP-1 medications have described symptoms like vaginal dryness, irritation, increased or decreased libido, and even changes in how sex feels. Now, if you're thinking, wait, how could a diabetes or weight loss drug affect my vulva? You're not alone, and here is where the science comes in. GLP-1 drugs like Ozempic affect metabolism, hormones, and blood flow, and all of those things play a huge role in sexual health. Vaginal tissues are extremely sensitive to hormonal shifts, and when estrogen dips, like in menopause or after childbirth, sometimes with sudden weight changes, vaginal dryness and discomfort can follow. And what's wild is sometimes rapid weight loss can mimic what happens during menopause. Fat tissue produces estrogen, so when you lose a lot of fat quickly, your estrogen levels can drop. Lower estrogen often means vaginal dryness, irritation, and changes in sexual desire. So here's the problem. People are using Ozempic in record numbers, but most were never told about potential side effects related to sexual health. Doctors often focus on blood sugar, weight loss, and heart health, which makes sense, but they don't always talk about changes in sexual health and specifically in vulvas and vaginas. That leaves a lot of women feeling confused, ashamed, or like something's wrong with them. And let's be real, when something affects your sex life, it can affect your whole life, your confidence, your relationship, and even your mood. So if you're sitting there wondering, why does nobody warn us about this? You're not alone, and unfortunately, women's health, as we know, doesn't always get the attention that it deserves. So let's break down Ozempic Vulva into a few key layers. Number one, hormones and estrogen. When weight drops fast, estrogen sometimes drops, and estrogen is crucial for vaginal lubrication and keeping tissue elastic. Without enough, sex can feel dry, painful, or even lead to small tears or recurrent infections. Number two, blood flow. GLP-1 drugs influence how your blood vessels respond. Good blood flow is essential for arousal and lubrication, and if blood flow decreases, so can arousal. Number three, desire and libido. Here's where it gets tricky. Some people report that their libido goes up on Ozempic, while others say that it crashes. Why? Well, part of it might be psychological. When you feel more confident in your body, you may feel sexier and thus want sex more. But if you're battling dryness or discomfort, desire can tank because who wants to engage in sex that feels uncomfortable? And layer number four, mental health. These medications can also change your relationship with food, body image, and mood. And as we know, mental health and sexual health are deeply connected. So what do you do about it? Here's where I really want to empower you. Number one, talk to your doctor. Don't just push through painful sex. Ask about local estrogen creams, lubricants, or other treatment. Remember, sex should never be painful and you don't have to suffer in silence. Number two, use lube like it's your best friend. Seriously, silicone-based lubes, water-based lubes, natural lubes like coconut oil are all options, and there's no shame here. If sex feels uncomfortable, lube can be a game changer. Number 3, consider pelvic health specialist. Pelvic floor physical therapy or sex therapy, like what I do, can help to address both the physical and emotional layers of what's happening in your sex life post GLP-1 drugs. Number 4, give your body time. Remember, your body is adjusting to major metabolic shifts. Sometimes things balance out after a few months. And number 5, redefine pleasure. Explore solo touch, toys, fantasies. The more that you engage with your arousal system, the more pleasurable sex can be in this new stage of life. So let's recap. Ozempic Vulva is a real conversation worth having. While it's not an official medical diagnosis, it reflects real side effects that people are experiencing, like dryness, irritation, and changes in sexual desire. It's linked to hormonal shifts, blood flow, and rapid weight loss. But here's the bottom line. You're not broken, you're not alone, and there are solutions, medical, emotional, and relational, that can help. That's it for today, but if you'd like to dive a little bit deeper into how GLP-1 medications like Ozempic can impact your sexual health, take a look at the video that'll be popping up on your screen next. Also, if you've experienced changes related to some of these medications and you feel comfortable, please do put that in the comments below or share some of the things that have been helpful for you, as they might be helpful to other folks in the comments. Beyond that, thanks so much for watching. Please don't forget to like and subscribe, and remember, you deserve a healthy, happy, and pleasurable life.